Welcome, everyone. We'll officially begin at this point. My name is Kim Weed, and I'm the co-director of the Hive Lab and associate director of, we're just going to call them the LMC programs, right? All of the different curricula related to this interdisciplinary field of health humanities that are housed in the English department. So we're running this event tonight, this career panel, to help folks who are maybe embarking on some training in health humanities or maybe curious about what that might look like, start to imagine the kinds of career possibilities that are available with that kind of training. So we have this amazing panel this evening, and we'll be working on another panel in the spring with folks who have gone into like clinician roles, so direct healthcare providers for our second round of these workshops. Just a few logistics for today. You are absolutely invited and welcome to turn on your camera if you'd like to give our panelists an audience of smiling faces and affirming nods. But I think while our panelists are going for this sort of opening portion, let's keep microphones muted so that we just minimize interruptions. But once we get to the more open Q&A portion, we'll have you either raise your hand using the raise hand feature in Sakai, or this isn't Sakai, on Zoom, and or you can type your question out in the chat. You can always add questions to the chat as we're going, and I'll try to keep an eye on those and see if I can elevate them and bring them to the attention of our panelists. Okay, so I think that's it logistics wise for our work tonight. I do, like I mentioned, this is part of the broader health humanities programming that's housed or comes together in the Hive Lab, which really I think of as a hub for these sort of three areas: health humanities research, health humanities curricula, and programming. So we've had a lot of programming this term. This is the last one of the semester, but we'll be back at it again in the spring. So I can put the link to, actually what I'll have you do, if you're interested in joining our mailing list, you can type your email into the chat and I'll export those to our mailing list so you can stay up to date on the events that are coming. And folks who are joining us from UNC or from some of the undergraduate students here know that we have a number of health humanities curricula. So whether it's the honors and ECL minor in medicine, literature, and culture, an English major with a concentration in science, medicine, and literature, and even a BA/MA program that helps you combine a bachelor's degree in English with our master's program in literature, medicine, and culture. So tons of options for you. And I am always happy to chat with people. So you can be in touch with me if you want to talk through more of that. So just some context about who we are and what we're up to launch into the beginning of our actual career panel. So all of these incredible UNC alumni have been affiliated with the Hive Lab, some of our programming, some of our research, some of our curricula at varying levels and to varying degrees. So I will let the panelists introduce themselves as we get there, but I think I'm going to hand things off now to Sarah Lofstrom, a PhD student in English and comparative literature, who is facilitating these career workshops and programming for us. So Sarah, I'll have you take it away.
Awesome, thank you, Kim. Well, hello all, it's so great to have you here, and we're so excited to have the panelists here, as Kim said. Megan, Katie, Manisha, and Brandon, welcome. So first things first, I'll just have each of you introduce yourselves. Megan, Katie, Manisha, and Brandon. Just introduce yourself, include what you're doing now in your current job, in your current role, and what you did at UNC. So how are you involved with Hive, either majors, minors, I know some of you did the MA program, include that, and it doesn't matter which order you go in, take it away.
So hi, I'm Manisha. I graduated from UNC in 2018, yes, and I double majored in biology and interdisciplinary studies, where that's basically where you can create your own major, and I actually did that out of Hive and created a medical humanities major, and my bio degree gave me a chem minor, So that came with that. While I was at UNC, the Health Humanities Journal was my little baby. So I started that from a capstone project within Hive. I think it was English 695. I don't remember what the class title was called, but loved that class. So the Health Humanities Journal came out of there. And then the summer of my junior year, through Honors Carolina, Hive also helped me out to develop my Birch Fellowship proposal. So Jane Thralkill was my mentor for that. And then I got to go to London for a summer and do some awesome work in the health humanities with this arts dance program in medical education, and do a lot of literature review at the Wellcome Library. And then after UNC, I continued on to grad school at Vanderbilt, where I got my master's in medicine, health, and society. So that was a one-year program, which was great. And it was there where I got into clinical research. And from that led me to my current job here, where I've been since 2019 at NYU Langone Health. Started off as a research coordinator. Just in September was promoted to a senior research coordinator, so getting old in this role. Working in the field of addiction medicine at Bellevue Hospital. So taking clinical studies and just implementing them in real life, working with clinical teams, working with social work, working with admin. It's a very interdisciplinary job, and we'll get into the specifics of it later. But that's my background.
Hi, I'm Katie Huber. I am currently a policy analyst at the Duke Margolis Center for Health Policy. I also graduated from UNC in 2018 with Manisha and was involved in Hive since I think midway through my sophomore year as a volunteer, and also worked on the journal with Manisha as an editor. So that was a lot of fun. In undergrad, I studied anthropology and interdisciplinary studies, also created a major in medical humanities that kind of was based on the courses in the medicine, literature, and culture minor, and then minored in biology. And then after graduating in 2018, I stayed at UNC to do a master's in public health and concentrated in health behavior. And so really grateful to be here and talk with you all more.
My name is Brandon Rogers. I'm part of the initial cohort in the Literature, Medicine, and Culture Master's program. So the first people to go through is me and one other person. So we're kind of the OG LMCers here. So when I first started, I came out of the University of Central Arkansas with a bachelor's degree in biological physics and creative writing. And then I came to the master's program here at UNC in Literature, Medicine, and Culture. And now I'm finishing my PhD. There's a lot of comments here, guys. My PhD in Communication, Rhetoric, and Digital Media at North Carolina State University. So I've been in school for a bit. When I was at Chapel Hill, I basically was kind of wanting to do this project as a bit of a gap year for me before med school. And one of the perks that I got to do is I got to take classes with the social medicine department, so with medical students. Realized med school wasn't for me for various reasons that we can get into later. But yeah, so while I was a part of the program here, I was the community outreach manager, which meant that my kind of baby of miniatures was the Health Humanities Journals, then mine was the volunteer program. So got that kind of off the ground, and that's how I got to meet Katie as well. So I have a bit of a lineage here. That was in my first year of my master's. And so I did the master's in 2 years. So my second year, I got a job as a communications coordinator for the Duke Health Humanities Lab. And so I was getting a little bit more training and kind of doing more formal outreach. And then after that, as part of my PhD program, I started getting more into communication research, specifically about gender minority and sexual minority health. And now I'm working as a health communications specialist while also finishing my PhD with AmeriCares. And AmeriCares is a medical emergency relief nonprofit organization. We serve over about 70 countries and we're the largest donor of donated pharmaceuticals nationwide. And so part of my project there is, although I'm hired by them as a health communications specialist, I'm actually paid by the CDC through a cooperative agreement. So our work is on instilling vaccine confidence in the COVID-19 vaccines in the free and charitable clinic sector. So those are the clinics that don't get money from federal sources. And honestly, I think the State Association for North Carolina is one of the oldest in the country. So we can get into more what that looks like later. But yes, that's me. Hi, everybody.
So I'm Megan Swartzfager. I did the master's in 1 year last year. So I finished 6 months ago, but it feels like it's been a lot longer than that. So I came into UNC with a bachelor's in English and a minor in society and population health from the University of Mississippi. I really didn't know what I wanted to do with that, but I think my junior year, I found that the LMC program existed and fell in love with the idea and enrolled and ended up taking quite a few classes outside the English department, which was really educational. I apologize for the cat. Yeah, like Brandon said, I got to take some classes with med students, and then I took a public health course. I took a library sciences course in evidence-based medicine. I think the way it ended up, only 3 of my courses were actually in the English department, which I think I missed English sometimes, but also felt really privileged to be able to expose myself to lots of other departments, because that is definitely not something that you get the opportunity to do in most master's programs. Finishing the master's in May, I graduated on a Friday and started my job the next Monday. So I was kind of limited in my job search just because my partner is doing a PhD at Caltech in Pasadena, California. So I was looking only in LA County. And I actually applied for a job through a healthcare staffing firm for a grant writer position at a hospital. And about 10 minutes after submitting my application, I got an email saying, hey, that job's been filled, but I'm looking at your degree title and I really want you to apply for this other position. So I did. And the next day I had an interview, and the next day I had a job offer. And it was just because the recruiters and the supervisors for the position were so impressed by just the title and the coursework offered in this program at UNC. So it's definitely sort of a position that I don't think that I would have found, or I guess been found by otherwise, which has been, it's felt really, really serendipitous. And I've gotten to use a lot of the skills that I learned in my coursework, but also in my position as kind of the GA for the Hive Lab, where I did a lot of web management, but also the grand rounds coordinating and a whole bunch of other stuff. So sort of the interpersonal communication and working with subject matter experts. And I've now gotten much more into HTML than I ever did just using WordPress. So it was definitely a good stepping stone. But yeah, I guess we can get more into the details later.
Awesome. So much, Megan, and to all of our other panelists for giving such wonderful introductions. We're going to shift into the question portion of our talk. And first, I just want to ask and a couple of you have kind of started to get into this, but what are the day-to-day proceedings of your job? What does that look like? And for many, if not all of you, I understand that's going to be a complicated question that includes a lot of different aspects of your day-to-day of your life. And then within that question, I also am wondering what you like about your job, and if you can speak a little bit to that.
For my job, my day-to-day is you're kind of looking at it in a sense, lots of Zoom meetings at this point. So I work remotely, but my work is, since it's an international organization, our COVID response is national. And what it looks like is kind of waking up in the morning, going through all of our emails and Teams messages and all that kind of stuff, right? But we have a lot of meetings with our state association. So we've partnered with state associations. So what this looks like for me is, from a communication standpoint, this is what you might think of as message testing, where you start talking to different stakeholders about what they want to get across to their clinics and whatnot. So I write materials for about 800 clinics nationwide, because we're paired with about 15 state associations. So there's those meetings on the one hand. I also have meetings with the CDC as we discuss kind of new strategies for new developments like pediatric vaccines coming out last week and stuff like that. And then a lot of my time is writing, honestly. And a lot of times people think of writing as this solitary thing that you do. And even though I'm at home writing, I have a pretty big team of workers who work with me as well. I'm a communications specialist, as I said earlier, but I'm also the health communications coordinator, which means I'm the manager of the other specialists. And so what we do is we have things coming in different languages that we're kind of getting fixed and getting links out. It's not just writing things like, things for the CDC website. I can send a link of what we produce, but it's writing scripts for animated videos. It's doing radio ads, any kind of like banner ad you see on Facebook. It's that kind of writing, but it's also infographics, things that clinicians can use to go through side effects quickly and that kind of stuff. So my day-to-day is in meetings, talking to people since we're paired with Puerto Rico and US Virgin Islands, it's being in meetings with these people. And honestly, it's kind of incredible because I'm working with people who have expertise in the World Health Organization, who are professors at Harvard, who are, doing all this insanely cool work. And so every day we just come in, we talk about things, we get it outlined exactly how we want to, and then we just do feedback back and forth. Because like today, we're just trying to do the catchy name for a new group that we're starting. And so it's just back and forth about really stupid things like, maybe we should just call it Just Show Up. That's not a good title, but it's a fun way to kind of get to know each other. And it's been fantastic. So those are kind of the fun day-to-day of my day. It's just writing things, working with people, trying it out, and making new videos. And I'll post a link in the chat here so you can see some of the stuff that we've developed.
So in clinical research, no 2 days are alike because when we work with patients, if our patient shows up, we got to drop everything and we got to find that patient because unfortunately, numbers matter for research. And especially with COVID, a lot of research studies have had trouble recruitment. So as a research coordinator, our priority is to work with patients. And to give a background, so I work in addiction medicine, which is pretty intense. A lot of our patients are currently experiencing opioid use disorder or a multitude of other substance use disorders. So it's a challenging population to work with, but then also add on the level that we work at Bellevue Hospital in New York City, which is the oldest and the largest public safety net hospital in the US, which is kind of crazy. And a lot of our patients come through the emergency department. So they're usually homeless, unfortunately, uninsured. They're going through very difficult situations in their life. And, as a research team, we're kind of in between clinical care and also social work. So we're basically the linkage for them. Unfortunately, at Bellevue with low resources, we put on many hats. So we're working with them in the emergency department while COVID's happening. We have our N95s, face shields, doesn't matter. And we're at the bedside working with the patient. So that could be one day. And sometimes our intake assessments can be 30 minutes. Sometimes they can be 3.5 hours. It just depends who the patient is and if they're used to research or we got to talk to them, work with them. Other days, meetings. So there's a lot of interdisciplinary collaboration. We can be working with data analysts who are based in DC. A lot of our studies are NIH funded. So we'll be working with a lot of data centers based there to report there. We have meetings with our PIs. So a lot of our studies will have at least 2+ PIs, and to get everybody in one page in the academic world at one time is pretty hard. And then, regulatory IRB stuff, great. Every week there's always additional stuff to submit. And then I also manage a team of currently 4 RAs. So, supervising them, training them, getting to know them and seeing what their interests are and how you as a supervisor can, fulfill that potential and allow them to grow. That's a new role I've taken on in September. It's challenging, but it's also rewarding. Yeah. And really what I like about my job is the patient population I work with. You can really learn a lot. I like to say Bellevue Hospital, as one of my PIs say, it's kind of like the international arrival at JFK, like at airport. It's just crazy when you walk in there and it's like a wonderful place to be. Hectic, busy, but you're always learning something. Turn one corner, you're learning something. So yeah, that's just like a basic overview.
So like I said, I'm a policy analyst at the Duke Margolis Center for Health Policy, and I've been in this role for about a year now and have been working on a few projects. I would say the one that's taking up the most of my time is related to COVID vaccination and supporting state leaders in distributing the vaccine and addressing any challenges that come up and improving. And so a lot of my day-to-day actually involves calling up state health officials or associations and seeing how things are going, what like really bright spots they're seeing, what things are working well, where they need more support, and then kind of trying to gather those examples and either write about them in like policy briefs or issue briefs, or sometimes we bring together different state leaders to really be able to talk with one another and learn from one another and be able to respond in that way. And then I also am working on a project related to pain management. So it's about trying to incorporate integrative therapies into treatment plans for folks with chronic pain. So things like acupuncture, yoga, and how do you really get health systems on board with that idea? How do you pay for those things? How do you implement those things? And then also just trying to really learn from others. And so I think my training at Hive really prepared me for that, because I know with a lot of the Hive studies, there's a lot of qualitative interviews and analysis. And I think that's where a lot of my day-to-day job responsibilities lie. And then also just bringing folks together, convenings, and then sharing learnings in policy briefs or writing. So a lot of my time is spent writing as well. And I think that's probably the thing I like most about my job. It is a very interdisciplinary center, and we kind of have one foot in academia, so you get to kind of learn about new research and contribute to an evidence base, which I'm excited about, but also you have this impact in the real world and an ability to impact policy and work on real world issues. So I really have appreciated kind of that intersection and getting to work with a lot of different people.
My official title at the Los Angeles County Department of Public Health is Health Program Analyst to Medical Editor and Technical Writer. Normally, if people ask, I tell them I'm a medical editor. I work in the Medical Information Center in Acute Communicable Disease Control. Essentially I deal in acronyms all day. I'm in the MIC at ACDC at LACDPH. Really, there's not a normal day. I think the only thing that stays consistent is I'm actually a contractor under a federal grant for COVID programs. So I'm technically not supposed to touch anything that doesn't have to do with COVID. But that still leaves a really wide range, especially because in LA County, there are more than 30,000 healthcare professionals, and there's the kind of LA Unified School District is populated by just tons and tons of students. And because the Medical Information Center deals with any acute communicable diseases, everywhere that COVID might be, it's kind of our job to communicate about it there. So sometimes I'm working on vaccine stuff, sometimes I'm working on risk reduction, sometimes I'm writing about the science of transmission. I was hired to write for healthcare providers, but I probably split my time pretty equally between writing for providers and writing for the public. And sometimes that means kind of I'll get a call from an epidemiologist in the county who's saying, hey, the people who are working on the persons experiencing homelessness projects are having a really hard time with this sort of resource, and we need you to write something that addresses it. So that might mean I build a new web page where I compile any resources that we already have, and it's my job to be up to date on all the CDC, FDA, and any other kind of more specialized healthcare organizations research on whatever that topic is, just so I can make sure everything's in one place and accessible to whatever group is making this request. And I think actually the thing that I like the most about my job actually comes out of one of the most frustrating things about my job, which is because it is a government position, there's a lot of bureaucratic red tape. And one of the biggest frustrations and concerns that my supervisors have is a lot of the time they don't feel that they can kind of put the science out there for the public because they don't want to confuse people into making what they think are bad decisions. And that really rubs up against my health humanities training. So one of the things I'm proudest of is we had, when I joined, a webpage on masking, a webpage on vaccines, a webpage on symptoms, and one on testing. And that's really all the information we had for the public. We didn't have anything about how COVID spread or anything that kind of acknowledged that people are going to be in risky situations and we need to practice risk reduction. So I pitched a page for reducing risk that does exist now on the LA County website. And it puts together all of those resources about kind of foregrounding vaccination is the best way to protect yourself. Please, please, please get vaccinated. But also masking resources, how to pick the best mask, kind of how to fit your mask, find one that's comfortable that you'll wear, but that also protects you. And then also talks about how COVID's transmitted so people can use their best judgment when they're choosing to put themselves in a situation or not. So kind of giving people the tools to recognize closed spaces and ways that they can maybe improve ventilation, and if they're in a gathering where they can't maybe socially distance, but they can get a little more airflow and that sort of thing. So trying really hard to give people all the tools they have to make their best decisions, because we're 2 years into this and people have pandemic fatigue. So it's really impossible to ask them to be perfect all the time. So instead, I want to ask them to be smart and do the best that they can, kind of in spite of what situations they may have to or want to be in. So yeah, I think getting to use my health humanities training and advocate for the public, I think a lot of people in public health tend to underestimate the intelligence of the public. And so they focus on low literacy, but think that that means they can't also talk about the science. So that's where I've been able to push back a little bit, is say, like, we can get this information across at a third grade reading level or whatever our target is, just trying to give people all the tools we can. But yeah, I guess that's probably where I'll leave it, but I'm happy to answer any questions.
Thank you, Megan. That was wonderful. It sounds like something that's amazing listening to all of your responses and hearing about what you do in your day-to-day is that a core component of all of your jobs is communicating clearly and navigating really difficult situations around communication, whether it's communicating across groups with different literacy levels or communicating with individuals who are struggling with mental health issues, with addiction issues, communicating with people who are simply working different jobs and have different priorities than you yourself are bringing to your job. And that strikes me as something that health humanities is really valuable and imperative in helping people develop skills to communicate across barriers like that. Whether you're doing that verbally or, as also all of you mentioned a lot, writing. Writing is a huge component, it seems, of all of your jobs. So a few of you kind of already addressed this, but I would love to get into it a little bit more. Thinking about how you've taken your experience at Hive, and as Megan was talking about, how you've taken your health humanities training or research experience, where you find that in your current career, and how did it help shape your career path to kind of guide you to this job that you currently have. And maybe Brendan, we can start with you again. We'll go back in the circle.
Yeah, that works for me. Yeah, so I'll start with this. So as a reminder for people who are kind of new to this, I've been in a PhD program now for about 5 years too. So my feet have always been in academia and doing other things. I've always had a part-time job doing something throughout PhD, master's, everything. And all those have usually been some kind of communication work, either working here at Hive, working at Duke. I also worked at like a longevity institute who was doing like genetic research on anti-aging products, and now this current position. And so all of that being put together, these things kind of mix together. My research interests in my PhD aren't specific to medical humanities, but communication in a sense is kind of not jumped on the train of medical humanities as much as, say, English or anthropology has. So there's an academic side that we can definitely get into if you'd like to, but I'm not going to for right now. But if you want to, we could. But I'll use an example of how health humanities is super useful for me. And this came up in a meeting 2 days ago for me. So one of the things that we were dealing with has been around infertility in the COVID-19 vaccines. This is a really big issue in Puerto Rico. Not that saying that infertility and COVID-19 vaccines are actually related, but more so that people have a concern that they are. Now, in the US, stateside, continental US, we might think like, okay, well, maybe there's some kind of like connection to some kind of history or whatnot. Well, in Puerto Rico, it's a really specific situation on why infertility is important. So going back to the academic side of me, if you call my health humanities training is in the history of medicine. So this is what I actually focus on. It's like the history of medicine and how, medical treatments were done in the past and whatnot. So in Puerto Rico, for example, in the 1930s, they did this entire forced sterilization where the state was trying to promote sterilization as the only contraceptive method. And this is the continental US going forward and be like, hey, you need to get contraceptive, which means to get sterilized. And then you jump up 30 years to the 1960s, and they were doing contraceptive pill studies, but they weren't informing women that they were part of a contraceptive pill study. And this happened throughout the entire island. So when you're writing content to address these infertility concerns, it's not like, oh, well, these are unfounded ideas. No, like there's almost like 100 years close to of kind of an exploitation of people in this very specific realm. So you have to write based on that to kind of quell those fears. You got to try to address those. So this is how a health humanities training comes in helpful for me. Honestly, a lot of my work is since I'm more of a management, it's more of a national scale. So I don't get the opportunity very often to look into super local phenomena. But that's what health humanities has been super helpful for, is trying to figure out, okay, this is the background that we're talking to. This is why. And if you look through health humanities lens too, you can even see that the response, the kind of hesitation around vaccines, that could have been predicted. That's kind of the fallout of our medical history of kind of this health promotion angle where it's your choice to make all these decisions and we don't want any kind of government interference in our choices to be healthy. This is just a part of the history repeating itself. So all of that has been extremely useful for me in this project specifically, and honestly is one of the reasons I was hired for what is a pretty upper level position, was because I had this background and understanding of how history, social determinants, and all these things work together to inspire hesitancy. And once you recognize that, you can better address it by being more targeted and specific to address certain reasons for, certain problems for certain reasons. And I think that's all of the answers, right, Sarah?
I think also thinking about, that was wonderful. Thinking also about how health humanities helps to shape your career path. What kind of processes you navigated to arrive at the job that you have now. And I know that you're straddling multiple positions while also, being in your PhD program. But how did your experience at Hive kind of shape that path for you?
Yeah, of course. So Hive was my first opportunity to actually do community outreach and kind of working with a larger population. And I want to say that really for me, what is the whole width of my duration of my whole career path has always been about education. And throughout PhD master's program, I've realized, and I think health humanities speaks to this too, education isn't just something you get at a university. You get it you start to learn things about the world through books, through literature, through different kinds of science, through different perspectives on something, from embodied experience and all these different things. And so for me, what I've learned throughout is I want to educate people in a different way. So this is why I started doing health communications. I'm more interested in adult learning, which is going to be something that you're doing. And so I didn't mention this earlier, but our CTC project is specific to healthcare personnel. So this means that I'm always talking to highly educated, for the most part, or highly trained healthcare personnel who are also hesitant about getting a COVID-19 vaccine. And so this is a really unique way for me to have those conversations. So I think that's really the heart of it for me, is I've learned that I like to educate people, but I've also learned through through Hive as well as Duke and everywhere else, is that there's a lot of other ways you can educate people that isn't just being a professor or a high school teacher or something like that. So that's what's led me to health communications, talking to a wider audience, trying to deal with larger disparities problems.
I think I touched on some of the skills that I think have been really useful in my career and that I've built in Hive, including the qualitative research. I think something else that I really enjoyed about Hive is just the prioritization of patients' voices and people who are affected by a certain issue, like, that, like Brandon said too, just really listening to them and instead of, assuming they're uninformed or they don't know what they're talking about or they're hesitant, like understanding like the reasons behind that and working from them and learning from them and working with the community and people who are trusted, I think is really valuable. And so really appreciated that. I think something that I kind of started in undergrad was just kind of really diving into all of this, kind of just soaking it up as a sponge and learning, and was really exciting. And I was trying to think about how I could apply this to the real world. And so that kind of led me into public health, gaining some more research skills, learning about community-based participatory research and things like that to really help bring members of the community in to your research and learnings that way. And then honestly, I didn't see myself going into health policy, and I did. So I think another way that health humanities has influenced me is just keeping an open mind and really like being open and learning about new things and diving in and finding those new experiences, I think has been really valuable. And I came into college like pre-med, like I'm going to be a doctor, like I think so many UNC students are. And I feel like my path has been kind of windy, but I can't imagine it being any different now. And so I've really appreciated that kind of different way of thinking and kind of encouragement of diving into your passions and things that interest you and interdisciplinary learning in that way.
So when I was in Hive, my main research interest was clinical empathy. So I was like obsessed with narrative medicine, the doctor-patient, which I've now termed clinician-patient relationship, looking at the difference between empathy, compassion, and sympathy, because that's a whole discussion in academia between the three words and how they basically play out. Just carrying that on just really taught me, as Katie, Brandon, and Megan have all said, communication, how you shape your words, how you shape your thoughts, how you convey those thoughts. And really in Hive, a lot of my classes, and I believe it was more in the English classes, they were like Socratic seminar style, which I really liked because you're practicing not only conveying your thoughts, but active listening, reflective, engaging with ideas, disentangling ideas, questioning things that, maybe you did not see from that perspective. So engaging with different perspectives, I definitely got that from my humanities side. When you're sitting in like a chemistry class, you're just learning equations and formulas and that. So to have that very dynamic, interactive, like real time, this thing is happening in front of me education, I think the humanities is very unique in that. In terms of how the humanities led me to my career, that was a great question. So I think my mind's always been in research. So Hive also exposed me to research, to be honest. The Falls Narrative Study was my first time actually not doing bench lab research, like just pipetting stuff into a tube, but actually like we went out, we drove out, we went into these elderly individuals' homes. They welcomed us in, we sat there, we asked questions. It was my first exposure to qualitative interviewing, which I fell in love with. And when I was at UNC, I got a part-time job with a professor in social medicine, like qualitatively coding all her stuff. So I wanted a career where I could form a relationship with somebody. And really clinical research is that, because you are engaging with humans. You're not sitting on a lab bench where you're just doing slides, you're not looking at microscopes, but you're engaging with humans who are very complicated and have a story to tell. And, research really needs to tap into that more, because you're basically taking stories, gathering data, and what do you do with this data? And that's where communication and, understanding lived experiences matter. For addiction medicine, I think I just happened to fall into that. The first PI I interviewed with, he was really great. We talked about empathy in medicine for a long time, and we just connected really well. How I ended up at NYU. So my boyfriend, he got into grad school at Columbia. So, NYU was the major academic center, so I ended up just looking for jobs at Columbia and NYU. There wasn't really much of a thought process with that, but really Hive is what allowed me to, I think it allows me to be successful in my patient interactions and to gain that trust, especially at Bellevue, where a lot of patients are very apprehensive about getting medical care. So not only are they apprehensive, but then research is coming in and like, hey, we want to ask you like 1,000 questions while you are probably in pain and confused and don't know what the heck is going on. So kind of building that trust, working with them, having that trust so they also come back for follow-up visits. Yeah, communication is really important, and education humanities will definitely get you that more than a very STEM-based education.
My answer is a lot less elegant. So like I mentioned earlier, I really was looking for jobs based more on location than anything else. As an undergrad, I thought I wanted to do health communications, and then later in undergrad and throughout the master's program, I thought that I wanted to edit books. I wanted to do scholarly publishing or maybe kind of Big Five publishing. I wasn't 100% sure, but kind of my interest in studying English is really born first out of a love for language. And then kind of I found this niche through an interest in kind of how we talk about bodies and how that really permeates every aspect of life. So it's not as cleanly kind of an interest in medicine as it seems like some of the other students have indicated. It's a little broader for me. But the nice thing about that is it gave me a lot more flexibility too, I think, which was helpful because I was looking for a job pretty much exclusively based on location. LA seems to be the only major city where there's really not a publishing scene. So I was looking for health communications jobs that I could use to leverage my communication skills, but also this interest in and training in health and medicine, like the evidence-based medicine library sciences course I took, which has been really, really helpful. I took a course in Barry Saunders's course in the School of Medicine. It's social studies of science course. So really kind of thinking about knowledge production, which I think has also been really helpful, particularly in the job I'm in now. And again, I don't feel like I can talk really clearly about kind of a career at this point because first of all, it's been 6 months since I graduated. And so that's how long I've been in this position, which is a contract position under a federal grant. So it's up in February and sort of they won't know if they have the money to keep me permanently until February. So I'm kind of shopping around until then. I'm currently in interviews with the Rand Corporation doing editing stuff for them too, which I mean, working for a company like that is interesting because there's a lot of kind of health and population health stuff that they do, but it's definitely not only that. So it's really a broad range, and it's the editing skills more than anything else that I would bring. But I think also, like Manisha said, just kind of the adaptability of a humanities training is what's been serviceable to me in my current position and what I think is going to kind of keep pushing me through my career. Just because, like Manisha said, you really do have to think on your feet and be really flexible. I think kind of the corporate buzzword right now is utility player. So I've been doing a lot of web programming that I never thought I would do. And that's definitely not something I ever associated with a humanities training, but it's something I did as a Hive GA and something that's been really useful, I think, in getting our programming across, just because we can make these fancy web pages that what was a team of 3 before I joined and is now a team of 5. They just didn't have the resources to make kind of pretty web pages. It was just kind of text on a page, but now there's a little more of a design element. get to think a lot more about kind of the flow of information and where people are going to look and what's the best way to get it to them and be accessible. So yeah, I think it's really the flexibility, adaptability, but also kind of the ability to, I think it's kind of a generosity of the humanities. Like I said earlier, kind of assuming a higher level of intelligence in the public and being willing to give them more tools than maybe some of these public health professionals who have only been trained in epidemiology are willing to do. So it's been really helpful to me.
Thank you, Megan. I think something else that is striking to me listening to all of your responses is how both accessibility and building trust in the people that you're interacting with and in either patients or clients or just in Megan's case, the general public, right? Those web pages that you're creating for the use of the general public. And I think that methodology of building trust is also something that is just sort of like screams to me as being rooted in the humanities in general, and especially the health humanities of really putting a human first epistemology into how you're creating knowledge, how you're sharing knowledge, and how you're interacting with the people around you, especially folks who either have historically been disadvantaged by healthcare systems or are continuing to be disadvantaged or actively violated by healthcare systems. And I think that that's especially interesting and relevant and important to think about in the current time where we're living in a pandemic and many people still do not trust a vaccine for varying reasons, and that's a huge problem, both on national and local levels. So that was all a long-winded way of saying thank you all for your beautiful responses. This is wonderful. I do want to take a quick break just to give people the chance to ask questions, because I know that I've had a few folks message me about asking our lovely panelists some questions. So I figure we can go ahead and do that now. So anyone who would like to ask questions of the panelists, just go ahead and use the little raise hand feature on our beautiful, sweet Zoom sphere. And you can go ahead and ask your question.
Hi, so my question was like just about what kind of like research opportunities and like mentorship opportunities did you guys do like early in your career when you had like not as much experience, or like, I guess, how did you get started?
Great question. I can start for a little bit of it. So as I said, one of the things I didn't mention, the last thing that I think is really important to note about health humanities, and especially speaking to us here, a lot of us are trained in some way in a hard science or like in some kind of technical expertise in some way. And what's made us unique, or at least I've heard this in a dozen job interviews, it's like, oh, that's interesting, is the word they use, is the combination of the two, is like doing something like biophysics and a master's in comparative English or comparative literature. I bring this up because like for me, my start was actually working in a physics lab for someone who was doing, this is strange, my astrophysicist teacher was also a sustainable farming teacher in like sixth graders somewhere. And so for one of my labs for physics, what I would do is I would make PowerPoints, which would be turning these very dense academic articles about sustainable farming into these PowerPoints that sixth graders would enjoy and get an understanding of. And honestly, that's kind of what I do now in a sense. It's like I take this very complicated information and I put it in a way that people find engaging and fun to read and all that kind of stuff. So for me, it started with kind of trying to just find things that were interesting to me, even if they were like a little weird, because why would a physicist need a sustainable farming PowerPoint? But it was fun. So for me, getting a start was really just sometimes just being like, sure, I guess I could try that. And it seems like Megan does the same thing, like website design. It's like, sure. And I mean, I do graphic design now too. Like half the things you see on there are my graphic design. So I'm a graphic designer now. It's really just trying things out and taking an opportunity when you get the chance. Yeah, sure, you're going to find a lot of things you don't like. I found a lot of things that I don't like, but that helps you get your foot up to get something better. And as I always tell my students in professional writing, it's always how you spin something. So no matter what kind of past work or volunteer experience you've had, it's all about how you spin it as something unique for you or like something that fits a certain job position. So that's mine, was just trying new things out and kind of not falling into things, but just being open to changes and open to figuring out what you like and what you don't, because you'll never really know until you try.
I agree a lot with Brandon. I think my work in Hive was kind of my introduction to research and qualitative research. And so I was also involved in the fall study, but it was after the interviews were conducted. They were recorded on audio. And so one thing I did as a volunteer was just listen to the audio and write down word for word what folks were saying. And so that really gave me a chance to just like listen and learn how interviews are conducted and, you know, how this might be used for analysis and things like that. And so gradually kind of got to learn that way. And then also through a lot of the LMC courses, I think kind of teach you more about the methods that go into that, and then also give you opportunities to do your own research. So whether that's through like a paper or undergraduate thesis project, independent study, I think there are a lot of different ways that you can really explore a topic that interests you and propose a way to study it. And so I think kind of just building on your experiences and diving in and learning, I think there's a lot of opportunities through Hive, which I'm grateful for.
Yeah, piggybacking off of Katie, it really was Hive. The Falls Narrative Study was my first exposure to research and collecting, honestly, any form of data. I think it also helped that my first exposure to research through Hive was through that class, English 695. I'm assuming it's still a class at UNC. I highly recommend that. If you want any exposure to research in the health humanities, that's a great guided way of, we met once a week. We maintained these really nice lab notebooks where we were just literally whatever thought we had at any time of the day, we were encouraged to jot it. So we like collected this progressive journal throughout the semester, which was really nice. I still have it somewhere here. And English 695 was really what got me thinking about research, how to create a question, how to like create a hypothesis. Ironically, what you would learn in a traditional biology class, I was learning more in a health humanities class, like how to create methods, how to test it. So I highly, highly recommend that class. And then as Katie said, like there's a ton of opportunities at UNC where you can build upon it. If you want to write a thesis your senior year, definitely like explore options through your classes, different coursework, themes that come up, literature that you read. It also helped for me that Hive was also female-led. Felt very comfortable with that, you know, Professor Weed, Professor Thralkill, Professor Jordan Jack. The three of them were basically the main people who got it going, and I'm sure other people were there in the background, but they really got Hive going when we were undergrad students. And it just really was inspiring to me also like getting advice from them, just how they were going through the trenches with all that. I also highly recommend the Birch Fellowship if you are, I believe you have to be a junior or a senior. I can put the link in. That's a great way if you have any interest in receiving, like I believe it was up to $6,000 to travel and to do any research study. It does not have to be within a field. It can be as interdisciplinary as possible. Find a mentor and write. It's literally you create your own project, and I think it's a great way just to go out there and do some field work. Yeah, that was my exposure and how I found some mentors. Basically, Kim, Professor Weed, and Jane Thralkill have been my mentors throughout undergrad and grad school. I had Kim for one class at Vanderbilt, so yeah.
Yeah, I think kind of like Brandon was saying, just really taking opportunities at any chance is the way to do it. I was always, as an undergrad, kind of embarrassed to tell people what classes I was in because they were just all over the place. By the time I finished, I had enough hours for a second degree, but all those hours were just everywhere and wouldn't have added up to a degree. So I took a lot of biology courses. I took a couple of chemistry courses and was really bad at it, but had a great time. I took statistics just because I thought it was fun. I took nutrition. I took a couple of speech pathology courses and linguistics courses and sociology, psychology, anthropology. My degree was in English. I minored in classics. My foreign language was ancient Greek. So it really was like everywhere. And my first real research exposure was just born out of, I was taking a sociology class for fun with a professor who had previously worked in the rural agricultural part of Mississippi, where I'm from. I'm from the Mississippi Delta. So if you know anything about the Mississippi Delta, it's bad. And my mom works in healthcare, and so I was really interested in health disparities, but didn't really have any language to talk about it. And this professor said, hey, I'm starting this project. We're going to develop a policy proposal for presumptive eligibility for Medicaid for pregnant women in Mississippi. And we're working with the March of Dimes. Come to my office, let's work on it together. So I was calling people in public health departments in a whole bunch of different states to ask about how they operated their presumptive eligibility programs. So there was a lot of qualitative interviewing, but also I was working with quantitative data for the first real time, because I had taken that statistics course, but it was kind of all these hypothetical problems. And this was the first time I'd had to apply any of that knowledge. And that's really what kind of pushed me into an interest in population health and ended up bringing me to the LMC program at UNC. So really talking to people, being curious, even if it means that your transcript looks a little wild, satisfying that curiosity, talking to people who encourage and foster that curiosity. And that's something that I've tried to maintain since then. Kind of right now, I have this full-time job at the LA County Department of Health, but I'm also doing like some grant writing for an indie publisher and some literacy outreach stuff and stuff like that. I think Kim knows that I like to keep my hands as full as possible. So really just, if there's something you're interested in, run, don't walk.
Wonderful, thank you all. Any other questions? If not, then Kim and I will, of course, happily jump in, but we want to make sure that we're giving our audience members the chance to ask questions.
Well, I think I will take the silence as an opportunity to jump in, if that's all right. And I just wanted to say, I mean, thank you all for this. I'm just loving hearing more about what you've been up to since I last saw you in Hive, or on Zoom, as the case may be. But something that I really kind of heard across all of your descriptions of the jobs that you have and what you do, there's a good amount of writing involved. So I'd like to hear more about okay, so I do teach writing, right? So I'm thinking in terms of genre. What genres do you most often write in the positions that you're in? And how did you learn to write those?
Sure. I think something I kind of dived into in the latter part of my public health training. And so there's one course in the public health school where we really like picked an issue and took it all the way through kind of what you really need to do to, understand an issue, think about what are the solutions to the issue and how to implement those potential solutions. I think it is kind of very practical and to the point, but at the same time, it is very like narrative and telling a story and kind of convincing the folks that are in power who may or may not agree with you, like why this is important, why it matters, why they should care about it, what they can do about it. And so kind of trying to package that all up nicely and kind of make a convincing argument is really the gist of it. And I think that's definitely something I've learned in Hive as well, is just thinking about how to write more succinctly and communicate to different audiences and all of those good things. So
to build off that too. So I mean, if you guys follow that link, you'll see the very, very, very large, wide range of things that we write. Like we write animated videos, we write documentary videos, infographic, like there's a very long list of things that I write in a day-to-day basis. And I stick with the same thing that my creative writing teacher told me in undergrad too. There's only one way you'll ever learn how, or I guess two connected ways you'll ever learn how to write. The first is to read a lot of the same things that you're going to be writing. And the second is to write and write it more. So you don't really get to know it until you just to practice it. This is why I keep saying, like, if somebody gives you like a weird assignment, or if a professor gives you an opportunity to do a weird version of an assignment, like not a paper, write a rap, and you're like, okay, try it, just see what happens, because that's going to make you a little bit more interesting of a writer, and you're going to understand there's different ways of doing it. So one of my favorite ways of doing any kind of writing, especially for videos, is always just read it. Like if you feel like you're getting out of breath at any point, if you feel like you were talking to your grandmother and they would not understand what you were saying, it needs to be edited. It needs to be a little bit smoother. It needs to make more sense, to be more fun. So my range is just insane. And that's the best part of my job, I think, is learning how to write things by just trying it over and over again. And half the time you do that because you're working with cool people who that's their specialty. They might not know how to turn cool, like, hefty scientific language into a video, but they know how to make a video. And so you guys just go back and forth and ping pong off of each other. That's what the fun part of interdisciplinarity is. You get to bounce off of each other. You're all experts in something different. And, that's the fun part. That's the fun part of writing all this new stuff, is you get to really learn from other people. And that's a big takeaway too, when you're thinking about writing. No one is personally attacking you when they edit a piece of paper, right? If you write something, it is not because they just like despise the essence of your being. It means that they're usually trying to help that paper get better, or trying to help that response get better. You will never, if you go into any kind of communication work, as I bet any of the people here can say, someone will be looking at your stuff all the time and everyone will have a comment about something. Like, there is no way to get around that. But it's not about you. It's just they're trying to make it clear, and you got to be open to hearing those kind of things. So always be open to feedback about your own writing process. Be willing to try new things. I really highly recommend taking a creative writing course if you get the chance, because it's a really different way of thinking about writing, as opposed to like a scientific paper, but they both use narrative in a way that needs to be compelling. So I think that would be a fun way to do it.
Going off the theme of ranges, so in clinical research, we, we'll have to, for some of our participants for a study, we'll have to do like posters and flyers that have to be approved by the IRB. And I believe it's an 8th grade level or below. So you try to make it very simple, plain language, and then that has to be approved by the IRB, but always they're going to find like 1 or 2 words and you have to change it. Like literally, it's annoying. You can't use the word compensation. You have to use like gift card or something. Like they want it as plain language as possible. We do progress reports to our sponsors and funding agencies. These are really technical, short 1-2 pages, very technical writing of where we write down, like literally, we did this from March 5th to May this. We got 20 patients. This is what worked. This is what our methods were. We also do protocol and standard operating procedure writing. These are pages and pages of like writing of what is the background? What is the methods? How are you going to do this? What are the limitations? What is the science that you are proposing to study? And they go through rounds of edits. So it's not only the PIs who are doing it, you're also going to send it to people at the NIH. They're going to read it. They're going to approve it. They're going to send it to, sometimes the RCs read it. The project managers also read it. There was one more thing I wanted to say. Grants. Grant writing is also another thing. It's been a while since we did grant writing because it's really hard to get grants now. But grant writing is also a very collaborative procedure. Yeah, so we can go anywhere from writing very simple, fun language to also writing very technical language. Oh, also, field notes. That's another thing we do. So we do notes to file. If a patient would say something really interesting to us, but we can't capture it in one of our data collection forms that we currently have, we just grab a piece of paper, write note to the file, and it's like ethnographic research where you just write down observations of what you're doing, what the patient said, whatever you want. So it's kind of like free writing. Yeah, so that's how it's been for me, at least in clinical research.
Yeah, I think I use a lot of the same types of writing that Brandon and Manisha use. Grant writing, not for my job, but for some volunteer positions. And then I think one thing that really surprised me is that a lot of the time it's the internal communications that I have the most fun with, because I get to be a little more technical and narrative than I would otherwise be. Our web pages for the public especially tend to be kind of anti-narrative. We want as little text as possible. And sort of kind of when I started to feel like I was really getting good at writing for the public and thought I had the hang of it, I realized that you really, it's hard to have a lot of fun with it when you're writing something for translation into 12 critical languages, because a health educator and I had this this thing we were working on. When we were talking about risk reduction, we were talking about the 3 C's: avoid close contact, crowds, and closed spaces. The more C's, the higher the risk. And then we realized this isn't going to make any sense when you put it in Armenian. So I think I've had to be really conscious about stripping back my language, which is kind of really not me. I have always been really wordy, as I feel like you can probably tell just by how I talk. But that's something that I've had to really work at, kind of getting my even just really short blurbs for web pages, just getting eviscerated by my supervisor for the first couple months. And now I don't think she even really looks at them, because it does kind of become second nature. And it's like Brandon said, the best way to get good at a particular kind of writing is just to do that kind of writing over and over and over and over. Especially with really critical editors. And what's, I think, especially interesting about being a language person in this environment is I'm the only one in my department with any English training. Everyone else either has a public health degree or a medical degree. My supervisor is an internal medicine MD. And so it's really subject matter experts in environmental health, and these sometimes we'll be talking with the head of emergency medical services for the public health department and that sort of thing. So there's a lot of butting heads about kind of, this is the technical language that this population uses versus kind of, this is the language that the federal government is using versus kind of, this is the language that the people who are actually going to be accessing this information instead of just the administrators are going to understand. So it's really collaborative, which has been fun, because I might write something after reading many documents from the CDC and the FDA and whoever else, and then get input from some MDs, input from some MPHs, and then from people who have kind of spent 50 years working admin in kind of a really niche field in medical administration. So it's really collaborative, and it's not something that I think I could do without my health humanities training, just because there's a lot of consolidation of different knowledge systems and communication types. So it's been a challenge, but I think it really, having to work collaboratively like that and across a whole bunch of different styles of communication makes you a better writer and editor in general. So I definitely think I've grown a lot as a writer, like as an essayist, just by writing kind of bullet points for a web page, which is not something that I thought I would have ever said before.
Thank you, Megan. I actually have sort of a follow-up question that sort of fits in with what you were talking about, that I had been wanting to ask before you answered. But so the public websites that you've mentioned, where you're having to create that really accessible, not condescending, not insulting the public's literacy and intelligence around health issues, but also wanting to genuinely provide enough information. What did those conversations look like between yourself and, you mentioned, the people butting heads of trying to walk the line between all these different styles of writing, and find the perfect amalgamation and compromise of all those different needs or priorities that people are presenting. How did you negotiate that?
Yeah, so I guess the first thing I should say, and this was disappointing to me and might be disappointing to you guys too, but one of the first things my supervisor said to me was, a lot of the time we have to be okay with doing kind of B+ work, because we're working on a really quick turnaround, which I'm sure all of you who are working on anything to do with COVID are familiar with. Kind of the way we're talking about the science is always changing. The last few weeks with vaccines for kids have been crazy. So it's really fast paced. There's not often a lot of time to really sit with a particular project, unfortunately. So a lot of the time, kind of a problem area will come out of another project. So we might be updating our page on masking and realize that kind of it's getting a little complex, and there's information that maybe doesn't even really belong on the masking page anymore, but would be helpful to the public in helping reduce their risk. So when I'm revising the web page, I might try to put a little pop-up or something on the web page with a little bit of more information, and my supervisor might write back, "This is too confusing. I don't want to touch this with a 10-foot pole." And so we might loop in someone from another team or one of the health educators, and kind of I'll say, "Here's why I really want this." And my supervisor will say, "This is why I really don't want this." And essentially the outsiders pick a winner. But my supervisor doesn't ever push something like that. So it's up to me really to figure out a way to implement that. So it may be the sort of thing like with this reducing risk webpage. I worked in my limited spare time for probably about a month and a half on putting together text and resources for this one page, because I was frustrated about this one gap in information. And when I had something that I was happy with, I sent it to my supervisor, and she kind of begrudgingly said, like, "Okay, this is good, let's post it." So it can really be, I think sometimes people take it personally, but a lot of the time it's because there's a lot of weird legal territory in public health. And they could get in a lot of trouble for being even a little bit confusing about particular things. So it's something that you really have to work hard to make sure it's super refined, kind of cite all your sources and that sort of thing. So again, like Brandon was saying, it's never anything personal, even though it can sometimes feel that way. But a lot of the time tensions are fairly high just because the stakes can be so high. So you do have to kind of be patient with where people are coming from, but also I was not comfortable at the beginning being firm in my stances because I was fresh out of school and had only been in the position for a short amount of time. But since I've sort of gotten my feet wet, I am a little more comfortable being assertive and saying, kind of taking initiative, putting something together and really pushing to make it live.
Manisha, I have another question for you, if you don't mind. But you've talked a little bit about how interdisciplinary your work is in the context that it crosses clinical work, social work, research, and et cetera. And I'm wondering if you can speak a little bit more to that. Like, what other career paths have you seen interact or exist within the field that you're working in? What is your perception of those?
Absolutely. So when I first joined as just a research coordinator in emergency medicine, I was like, okay, research is its own isolated little world. The patients are going to call us up. They're going to come in. We're going to have a separate room. We're just going to work with them. We're going to give them their compensation. We're good. No. We are literally, so we work in our office space, and it's, with other research teams, our PIs usually are MDs. Some are MD, PhDs, very rarely just a PhD, are in the space with us. But once we identify a patient on Epic, the medical record board, we walk right into the ED. We pass the security officer. We got to show him our badge. We pass the triage nurse. And in the emergency department, it's literally everyone is everywhere. So we will first introduce ourselves to the nurse to let them know, like, hey, we're from research. Research is always secondary to clinical care. My name's Manisha. Feel free to pull me to the side whenever you need to go do your thing. Then we introduce ourselves to our patient. Usually, since Bellevue is also a teaching hospital, there's going to be medical students, residents, and attendings, and then those who are in fellowship, so in between there. So then they're going to come in. We introduce ourselves to them, which is kind of scary at times. Sometimes they're nice, sometimes they're not. And then we're working in a very collaborative, dynamic environment where when we see the person in their clinical care coming, we know to step aside. We know their names that we're introducing, like, hey, Dr. John's coming over. We're going to be back in 5 minutes. We work very close, however, with social work. So there's this at Bellevue, there's a specific division of social work that focuses only on substance abuse and referral to treatment centers in New York City and then the greater tri-state area. And because the majority of my studies are addiction medicine related, and Bellevue's also understaffed, so we kind of help them out. It's a two-way street. So we really work with social work. So sometimes I find myself, making referrals, calling to see if there's an open bed in detox. And it's just a really great environment. It's challenging also. You're running around trying to figure out where the heck do you wait for 30 minutes while this guy's having an MRI done or something, like blood work done. But yeah, we have social work. It's a long-winded way of saying there's a lot of people, a lot of different levels, but everybody makes it work because you're trying to help the patient. That's the common goal. Yeah.
Thank you. That was wonderful. I do want to just check in with the audience members again and make sure that I'm not steamrolling over anyone who might have a question. And if not, I do have one more question, but I know we are also coming up on time here because we had talked about ending at 7:30. But I want to ask if anyone else has any other questions. Well, I do have one more question for Brandon. You had mentioned very early on that you sort of diverted from the med school path. And I'm wondering if you can elaborate just a little bit on that and what that thought process was for you of like, oh, I don't actually want to go down that path. I want to pursue something else.
Yeah, absolutely. I mean, luckily for me, I can pin it down to a very specific conversation with someone that kind of turned me off of the whole thing. So it might be a bit judgmental on my part, but I'll zoom out first before I get to the specific version. So the zoomed out version of the story is in a sense that, when I was never introduced to the health humanities in undergrad at all. It was not a world for me. I had no idea. The closest thing I got was a literature and medicine course that was never used the word health humanities, never used medical humanities in the words or anything, but it's the closest I ever really got to it. And it was in that realm that, I had a lot of kind of things happening along the same timeline. So the same time I'm taking literature and medicine is the same time my dad dies when I'm in college. It's the same time that like you start thinking over a lot of different things of what do I want to be when I grow up. And at that point, it's a little bit of a confusing area because I was doing creative writing as an outlet, kind of as an emotional outlet for myself, but I was also getting a major in biophysics as a way to pay the bills. And I didn't know what I wanted to really stick with. So when I did the master's in literature, medicine, and culture, I did so mostly for the E in Hive, for exploration. I really wanted to kind of explore what everything was. And what the master's gave me the opportunity, I always, whenever I do jobs, like, oh, you have a degree in comparative English and comparative literature. I'm like, I've taken like 3 classes in English and comparative literature, and I have a degree in it. That does not mean I don't know Shakespeare. That's not me. So that sounds weird, but for me, I took so many classes in anthropology. I took a lot in the communication department because my undergrad didn't have a communications department, and with the social medicine department as well. And so for me, kind of the point that I was getting to through all of this is like, I didn't really enjoy the day-to-day grind of this kind of like, every day we come in, we do this job, we serve a patient, we go home. I liked bigger ideas. Like I think Megan mentioned like Barry's class on like the epistemology, knowledge production, the social production of science. I'm like, this is interesting. I kind of like this. And I was taking classes in the history of public health and all this really cool stuff. And it was making me realize that my interest was in medicine, but it wasn't in medical practice. It wasn't something that I wanted to like go in and do. The closest I could probably get was public health. And even that was a little too quantitative for my liking. But the specific conversation as kind of a moment here was, I was in the class on the history of public health from the patient's point of view. And it was great. But I do remember sitting in there like before the professor came in, because that class was with second year medical students. So, you know, they're stressed out and everything else, right? They have a lot going on. And this is like the equivalent of a gen ed in med school. Like nobody wants to be there. They're just there because they need the credit to graduate. And I'm sitting there and this woman starts to talk to me and she's like, you know, this whole history, I don't need to know anything about this history of medicine. It's ridiculous. My job is to get patients in and out as quickly as possible. That's the end of my day. And okay, so, you know, probably had a bad day, a microcosm of a lot of things going on there. But for me, when I heard that, I was like, you know, I feel like that's not going to be the first time I would hear this. I feel like this is something that would happen over and over again. And I don't like daily grinds. I don't like feeling like the purpose is to get a number out, is to get a quota, and that's a fault of the hospital system. Like you have quotas you have to hit. Like there are, you know, certain metrics you need to do. It's not on you. It's a larger failure of the system. But I couldn't see myself working within that system. Like I liked critiquing the system, doing policy level work, trying to change things from that level, but actually being like on the ground. To me, and for anyone who wants to go to med school, more power to you. You are probably going to do fantastic at it and be a way better doctor than I could ever be. But to me, it felt like a little bit too much like grunt work. And I don't mean that in any kind of derogatory way. I just mean like, for me, it wasn't like really invigorating, and it didn't spark joy for me. It didn't make me happy. And because it didn't make me happy, I didn't want to go into it. And I mean, that's kind of even where I got to a point in my PhD too, is that academia, as like teaching in a university, doesn't make me happy, but educating does. Hence, I like doing health communication. I think that sums it up pretty well. But if anybody has questions about that, please feel free to either email me or speak up.
Yeah, no, that was great. And that was very clarifying. And you are not the only person that I've spoken to who has had a very similar experience or trajectory. And it often is boiled down to a single conversation of being like, oh, I actually don't want to hear that more than once in my life. And I know that I will if I choose this path. So I am conscious that we're essentially out of time here. But I just want to thank everyone who showed up and was an audience member here. We really appreciate you. And also a huge thank you to our panelists for being here and contributing to such an amazing, informative, and really compelling conversation. We are so happy to have you here and be able to have this conversation. And I'm sure that we will continue to be in conversation over many months and years. But thank you so much.